Hey everyone, this is Alex Barker with the Happy PharmD podcast. Thanks for listening. I'm really excited for these episodes. We tend to focus a lot on careers, but obviously if you haven't heard me before, my real passion is in business and innovation because that's how I believe we're going to get through our job crisis. And today with me is Lindsey Elmore. Why I want her on is because I think she is a great example for other pharmacists to essentially create an online platform that helps people with their health problems. There's this huge wave right now of health coaches, pharmacists becoming health coaches. And I think Lindsey has done an excellent job at her branding, with her marketing. And what I wanted to do with her today is share her story with you so that I could learn myself, but also you as well. And, consider this as an option if you've ever thought about, maybe I could take my services and help the public rather than just keeping it within the pharmacy. So Lindsey, thanks for hanging out with me this morning. I appreciate it.
Oh, thank you so much for having me. It's an honor.
So Lindsey, for those that aren't aware of who you are, could you give us like the few minute, career history? Where'd you go to school? When did you graduate? And what was your first job?
So I am originally from Birmingham, Alabama. That's where I was born and raised. I have a degree in chemistry, a bachelor's in chemistry from the University of Alabama, Birmingham. I then moved out to San Francisco and went to University of California, San Francisco, where I got my PharmD. And then I did a 2-year postdoc residency. My first year was in internal medicine, general practice at Princeton Baptist Medical Center. And then I went on to do my PGY2 at New Hanover Regional Medical Center up in Wilmington, North Carolina. From there, I went to work at Samford University and was a professor. I'm also here in New York City, so don't mind if you hear some sirens in our background. I live
Classic
down the street.
New York.
Classic New York. Everybody always tells me like, oh my gosh, is that because of the coronavirus? And I'm like, no, we live down the street from a hospital. It's okay. And so don't let it bother you. And so from after I practiced, at Samford, I was an assistant professor of pharmacy practice, as well as a residency program director. I directed a community pharmacy residency program. I then became a transitions of care pharmacist. So I worked in the hospital to help reduce readmissions following heart attacks and strokes, et cetera. And then I went on this really crazy journey where I found that I had a very special voice teaching people about essential oils and supplements. And so I went to work for a company called Young Living and worked for them for about 2.5 years and then decided to strike it out on my own. And I have been in 100% self-employed for more than 3 years now. And now I live and reside here in New York City. After living in North Carolina, I went back to Birmingham, Alabama, and then to Utah, and then to London, and now I'm here.
Awesome. So you definitely have, I think, what most people would call like you've practiced at the height of your license, right? You had a very successful pharmacy career and you did a residency and then you kind of went the like half leadership route, half clinical route, it sounds like, and then you also professor. So all during this time, did you go through like a slow transition to learn about business? Because I don't know about you and your education, but I never learned about business. In fact, my attitude towards creating a business was kind of soured. I don't want to say my school was responsible for that attitude, but I certainly felt like, wow, becoming like an independent pharmacist seems like an awful idea. And that was my idea of business. Did you always have it in your mind that you wanted to be in business? Or were you like, I read this book and it kind of opened my mind. What's your story?
So it was kind of trial by fire and just figure it out. I not to rip off Marie Forleo, but everything is figure outable, and so I remember when I went to work for Young Living, it was like, what, it was so many new vocabulary terms and so much like people were coming to me and they're like, okay, well, we need to develop an e-blast that drives to a landing page that does these things. And I was like, what are you guys talking about? And then it just kept getting layers and layers deeper to where now all of this vocabulary that no one ever taught me, really, you just pick it up. And now I feel so fancy in a way when I'm like, excuse me, could you tell me your API keys? And like, and you just pick it up along the way. And I am a very strong Enneagram type 8, which means that I am very driven to do independent work. I am very driven to work on my own. And it's been a blessing to me, So everybody out there, when you get fired from a job, how do you make that work in your favor? How, if you are miserable in your job, I remember reading an Onion article, which is a satirical newspaper. And I remember reading an Onion article one time that said, find what you really love and do it on nights and weekends for the rest of your life. And something snapped inside of me that I was like, I'm not going to do that. I'm not going to be that person who just does what I love on nights and weekends. How do I make this into my career? And now it is astonishing to me. I've gotten really involved with functional medicine pharmacists and pharmacists that are really teaching people how to live better lives. And I think an issue that pharmacists face is, number one, the one that you mentioned, is that we think the only way to go independent business is to open a retail pharmacy. I never wanted to go that direction. Number one, I don't like dispensing drugs. I don't. It's not what I think pharmacists do best. What pharmacists do best is medication therapy management, getting people to be on the right drugs for the right reasons, for the right duration, and all of those things. Pharmacists, we need to get paid for our brains, not for getting drugs out the door. And so I spend my days teaching pharmacists and honestly teaching people, yes, you can make a living telling people to eat right, drink more water, sleep more often, exercise more.
Yeah.
Everybody wants to know, what is the magic bullet? How do we stay healthy? And I'm like, we already know it. You eat right, you sleep more, all of those things. Yep. And so, I think that pharmacists also, the other bigger problem when pharmacists go into independent business is we aren't willing to tell people, my knowledge requires a fee, which is a big, big problem. And it's because pharmacy becomes so easy. Drugs, the human body, the way that, foods interact with medicine, all of that becomes so easy to us. We forget that it's not common knowledge. We forget. And so, like, just this morning, people are writing into me and they're like, I found this product and the state of California says it's carcinogenic. And I'm like, yeah, it's because the state of California doesn't differentiate between natural progesterones and medroxyprogesterone acetate. And they're like, what does that mean? And it becomes so easy for us. We forget to tell people that my knowledge requires a fee. And people get mad at me. And I've just learned to be very resilient towards it. People reach out to me all the time. Can you tell me how this drug interacts with this essential oil or with this supplement? Yep. When you book an appointment with me, I can absolutely do that. And they're like, why would you not just tell me? Because my knowledge is valuable. And so we as pharmacists have to understand that our skills go far beyond the dispensing of medications. And when you learn and when you stay strong that your knowledge has value, then you're in a position where you can start your own company.
All things that I think we believe at the Happy PharmD. You're fighting against a philosophy, unfortunately, that's been in our profession for over 100 years, right? Mm-hmm. We are free. We're tied to a product. That's slowly changing, and I think it has to change in order for us to progress. So remind me again, your previous job before moving to Young Living was a professor role, correct?
Yes, and then a brief stint as a transitions of care pharmacist, in a setting where people did not understand what a pharmacist could
Yeah.
do. And I think that that is a battle we're all constantly fighting, is people don't know what all we can do.
Yeah.
And because we were left out of an original Medicare legislation, we're still fighting these battles. You know, here amidst the coronavirus, we are seeing pharmacists be left out of personal protective equipment because people say we're not direct patient care. I have fought with
Yeah.
people for years who told me, you can't say, so you can't say that you have patients. Excuse me? No, those are absolutely my patients, and I will discuss them as patients. And so, yeah. So was in community pharmacy and then had a brief stint as a transitions of care pharmacist. But because people didn't understand the power of what a pharmacist could do, it's super frustrating. It's super frustrating for people like me when you can't practice at the top of your license. And especially having been brought up, so to speak, in North Carolina, where pharmacists have the most aggressive pharmacy practice act in the country, where you have clinical pharmacy practitioners. And I mean, it was amazing when my patients with diabetes or with pain or with asthma or COPD came in, and I was able, without asking permission, to just say, here's the medication changes, here's the dose of warfarin that I want you to take. And really seeing how pharmacists can manage medications more safely than doctors, because we have more training in medications than physicians, and like working with my physician residents and be like, no, you actually can't change a warfarin dose by 50%. It puts the patient in danger. And then
Yeah.
being like, really? Like, yeah, why don't you send them over to my anti-coag management services, and trust me, I'll have their INR balanced and ready to go within a couple weeks. And, you know, and seeing these physicians be grateful for that, you know, because physicians do things that we can't do. I'm not a diagnostician. I don't know how to diagnose many disease states. I'm not as skilled in differentials, but I can sure bang out medication management for sure.
You were in this transition of care position, and that's a position that is relatively newer and by all standards would be seen as, you know, a pretty safe job, a safe career. You've clearly done quite a bit of new things that I think a lot of pharmacists would see as, you know, you by all standards are like an all-star.
Oh, thanks.
But well, I mean, it's what pharmacists would tell me, you know, I believe it to be true. You then make this, probably by all standards, a very risky decision to not work in a pharmacist role from the outside. Obviously, you bring that pharmacy flavor to that Young Life company. But what made you say, you know, I'm going to leave traditional pharmacy job behind and pick up this new business role? Because most pharmacists do not think their next career move would be something in business.
You know, I mean, it just happened. You know what I mean? Being such an independent worker, I don't deal well with people telling me what to work on. I do way better when I get to decide what I want to work on. And I think that every entrepreneur's dilemma is that struggle between the insane confidence that, oh my God, I've got this product that's going to make me millions of dollars. And then the crushing, like, oh my God, this new product that I have is going to completely fail and it's going to be a miserable, you know, it's going to be terrible and nothing's going to work. But what I have found is that when I have those moments where I am so terrified by the vision of what I want to create, I'm probably on the right path. I am probably getting somewhere. And it just takes the daring to just jump off the ledge, just jump off the ledge a little bit and see where you go. Because, I mean, what's the best thing about being a pharmacist is no one can ever take your education away from you. You know, as long as you are an ethical and an upstanding pharmacist, nobody can really take your license from you unless you just don't pay your fees every year. That's the best. When entrepreneurs talk about what's your worst case scenario, What's my worst case scenario? I go back to my 6-figure a year job practicing pharmacy. Like, ooh, zing, sounds real tough. We have the best situation because we have a knowledge base that comes very easily to us. But yet we don't realize that it doesn't come easy to everyone else. I mean, when again, coronavirus comes back out, and people are like, do I take ibuprofen? Do I take Tylenol? I took a step back and I was like, holy crap, people don't know the maximum doses of Tylenol, and they don't know that they need to start taking glutathione alongside of
Yeah.
it. And they don't know that alcohol is a potential drug interaction. All of this knowledge that comes so simple to us is how we can create businesses. And so if you are someone who says, I really, really want to do something different than working in the pharmacy, think about ways that you can leverage your knowledge and gain new knowledge. Maybe you've got a special interest. I mean, goodness knows, I've gone a zillion different directions with my knowledge base. I can tell you in pharmaceutical terms about herbs, about supplements, about essential oils. I'm also a yoga teacher. I also can do emotional releases with you. I also know a little bit about Chinese medicine. I know a little bit about functional medicine. I know a little bit, and it's just because I meet people, they're interested in living their healthiest lives. They ask me how to do that, and sometimes it opens up new doors for me. And so I think that pharmacy is already a career where we are all lifelong learners. We have to be. We have to do continuing education. Make your continuing education about something that you're interested in, not the new drug on the market that you don't care about. Make it about something that you're interested in. And then don't feel like you have to start big. Start really small. There's a great book out there that teaches you about the minimum viable product. Don't worry about creating a multi-million dollar company. Figure out how to bring that first sale in the door. And the only way that you drive sales is by solving people's problems. When you figure out how you talk to a certain audience that has a certain type of problem, and you offer them a solution to that problem, that's how you make sales. And that has led me into business coaching. It's led me into online training, just the list goes on and on. And so I also had to break up with the idea that I was supposed to be one thing. I just said, I'm going to do a lot of different things, and I'm going to figure out how to make my website describe all of those different things that I can do. Because how do you describe a pharmacist, yogi, vegan cookbook author, business coach? Figure it out. Figure it out. And when you can figure it out, then you're in the position where you go, wow, I am bringing in revenue for a lot of different things that I never anticipated. And so I think pharmacists, we do online appointments, we teach on behalf of drug companies, we do all these things. But if you can figure out how to clearly make your website state what you do, why people need it, and how they buy it, you can drive sales. You really, really, really can. And it's finding an audience to talk to. And the only way that you craft an audience to talk to is by solving their problems. You solve their problems.
So you decided to venture out on your own to solve people's problems, right? You had worked for Young Life. Actually, it'd probably be good to step back for a moment because I don't think a lot of people have heard that name before. What is Young Life, and what was the work that you did there?
So it's Young Living,
Oh,
and
sorry, Young Living.
no worries. I was the director of global education. So you want to talk about like going into the big leagues. You're talking a $1.5 billion company. And now I'm in charge of all of the education for this company that's not just US based, but US, Canada, Mexico, Singapore, Hong Kong, Australia, all over Europe, like really big scope of what I was in charge of. And I just focused on one product. I focused on how do we deliver education that is meaningful, because, you know, the FDA really binds the hands of a lot of natural product companies
Yeah.
because they don't want you to know that natural products are actually the way that we all stay healthy and stay off of medications. You know, it really is. What's the key to health? Eat right, drink water, get sleep, exercise, have healthy relationships. It's not rocket science. It's really not. But yet, especially in the US, we are in a situation, we are in a system that it's one pill for every ill.
Yeah.
And so you have to be creative when you work for a natural product company. How do you teach people the power of natural medicines without actually making any disease claims? Because we as pharmacists cannot make disease claims about products especially if we have a vested interest in their sale. As pharmacists, we have a little bit of leeway if somebody comes in and says, you know, I hear that zinc may be important for, you know, battling the coronavirus. Which zinc should I use? We have a little bit of flexibility, but if you have vested interest in the sale of a product, you can't tell people like, oh, high dose vitamin C and zinc are going to be really important for, you know, helping you to prevent and potentially cure the coronavirus. It's illegal. You cannot do it. So we have to be creative and we have to teach people ways that they use products in their daily life and exemplify why it makes them healthy, how it makes them healthy, etc. So when I was working for Young Living, oh my gosh, I mean, it was nonstop. It was absolutely nonstop. And so I learned about marketing. I learned about sales. I learned about R&D. I learned about, goodness knows, I learned how to travel. At this point, in my career, I think I have spoken in 35 countries on 6 different continents about health and wellness, and just kept being creative, learning how to talk about products, learning how to teach people things that were meaningful. And what I learned was pharmacists have this amazing opportunity. There is basically nothing known out there in the general population about drug interactions, about disease state interactions with natural products. You can make a career just teaching about that. You know, I cannot tell you how many times I've been asked, I take warfarin, can I use this essential oil? That's a complicated scenario because sometimes people are coming to me and they're like, I hear that wintergreen essential oil contains high levels of salicylates. Do you think that that could replace my aspirin? Well, I can't teach you that, but I can teach you the signs and symptoms of bleeding, and I can teach you the signs and symptoms of a stroke, and I can teach you the signs and symptoms of a DVT. I can teach you the signs and symptoms of a pulmonary embolism. So we can teach safety of using supplements alongside medications, teach people how to dose their supplements so they're not causing drug interactions. Like, I cannot tell you how many people have come to me and say, I found this thyroid supplement. Do you think it could replace my Synthroid? I can't tell you that. That's illegal. But I can sure tell you how to take that medication so it doesn't cause drug interactions. And I can sure teach you the signs of hyperthyroidism and hypothyroidism that you can monitor. And then you can go to your physician and you can get your thyroid levels checked. Or if you're in the state of North Carolina, you can go into your pharmacist and get your thyroid levels checked, and your pharmacist can manage your Synthroid. So we can teach safety a lot. And safety is critically important. It's one of the things that we're paid to do, is teach people whether or not their medications cause drug interactions. It's very, very important. It's a very important service that we provide, that you can be providing it for free, or you can be leveraging your license, practicing at the very top of it, and billing Medicare, Medicaid, or perhaps your state has different ways that you can get paid for it. But you should be leveraging those MTM codes and billing for them on the regular, Because if you want to get out from behind the counter and get paid for your knowledge base, which I think a lot of pharmacists do, you got to bill for it. And you have to learn those CPT codes and just crank them. I know that when I was in my residency, we used our MTM codes and we billed for almost every single patient. My PGY2 project was, we extrapolated. So I did a month-long project where I rolled out medication therapy management in our oncology clinic. And so I didn't know anything about oncology. I wasn't even messing with their oncology drugs. All I knew was these patients also have diabetes. They also have hypertension. They also have cardiovascular disease, all of these things. I just went in and streamlined all of those medications. My 1-month project, when we extrapolated the savings out to a year, we would have generated more than $1.5 million in cost savings, because I recognize, like, this guy is covered in bruises and petechiae. He's on an oncology drug that increases the risk of bleeding. He's on warfarin. He's on aspirin. We need to work with his cardiologist to fix these things so that this guy doesn't have a massive bleed out because he's getting his cancer treated. Those types of things are creative services that, honestly, if you get physicians who are open-minded, of course, you've got those physicians that want to work in a silo and they want to tell you that you're an idiot and who gave you your doctorate. But as we've seen in, like, the documentary, The Pharmacist, that came out on Netflix, if you are a pharmacist who stands firm and is like, no, I'm not dispensing that medicine. Nope, I am not prescribing that drug. I'm not doing it. Find another pharmacist. Physicians will listen to you. I remember back in the day when Drotricagen, when Xigris was still on the market. And I remember my mother was a nurse. And she knew many of the physicians that I now worked with. We worked at the same medical center, my mom and I, for a while. And I remember I was on call one time, my pager goes off, and thank God for my hospital, we had restricted access to certain antibiotics and certain drugs. And so this physician who'd been in practice for 25 years pages me and says, I need this drug. And I did the math and I called him back and I said, your patient does not meet the criteria for Drotricagen, and I'm sorry, I can't allow it. And my mom was just like, I cannot believe you just did that. That is an attending that has been in practice for 25 years. You should give that doc what he wants. And I'm like, I'm not giving the doc what he wants. I'm giving the patient the correct medications. And I honestly, the next time I saw that physician, he was like, I'm so glad that you told me that my patient didn't meet the criteria, because they got better without this $10,000 drug. And that's the power of what pharmacists can do. And the pharmacist, I will never forget the first time that I saw a patient come in. You know, I was directing the community pharmacy residency program. So I'm sitting over in my little MTM patient counseling booth, and a patient walks in and hands a prescription to the pharmacist in charge, and he hands it straight back and says, I'm sorry, I'm not going to fill that prescription. You're going to have to find another pharmacy. And I went to him later and I was like, what the heck was that prescription? And he was like, 180 milligrams of OxyContin a day. And he was like, I would have killed that person. And being able to stand firm and say, nope, I am a bigger advocate of patient safety than I am of making money or at putting physicians at ease, you're winning right there. And I'll tell you a story. You know, North Carolina has the most progressive Pharmacy Practice Act in the nation, to the best of my knowledge. The reason for that is because a pharmacist named Bruce Canaday. Bruce was the first pharmacist in North Carolina to say, I'm going to go on rounds and I am going to manage medications on rounds. The Board of Pharmacy came to him and said, you can't do that. You cannot go on rounds with these physicians and tell them how to manage medications. And so he had the hospital revoke his access to the actual pharmacy where the drugs were stored. And he said, and so he goes to the board of pharmacy and he canceled his pharmacist license. And he said, I don't dispense drugs. I don't go into pharmacies. All I do is work with physicians to optimize patient care. And I teach pharmacists, and I teach patients how they should use their medicines. And the board of pharmacy was like, that's not the practice of pharmacy. And so he canceled his license and was like, I don't need a license then. Then if all I am doing is optimizing medications and training patients how to optimally use their medicines, you're saying that's not the practice of pharmacy. They changed the Pharmacy Practice Act to include educational services to basically force Bruce to get his license. But he just stood firm and he said, you know what? My employer says I don't need a license to provide these services. I've revoked my access to the pharmacy. And if you say that this isn't the practice of pharmacy, great. If you say it is the practice of pharmacy, change your Pharmacy Practice Act. And it led to a cascading effect where pharmacists really got to take ownership and control of medication management, at least in the state of North Carolina. And that's where pharmacists want to be. We all want to be practicing at the top of our license. It's exhausting not to practice at the top of your license. It really, truly is.
Love that story, Lindsey. So what's new for you in your world in this COVID-19 crisis? How's business going and what are you working on?
Oh my gosh. Okay. So I will say it is the greatest blessing of all time to have a home-based business at this moment. I faced no economic insecurity. I really didn't. And so I make my money online, and it was a great, wonderful place to be in, to just go, wow, my revenue hasn't changed that much. So that's a great blessing. It's also a great blessing just to not be around sick people. I think that's one of the hardest things that all healthcare providers, we in America are in a situation where we think it's normal to be sick. It's not normal to be sick. It's really not. Your body is designed to stay well. And it's one of the reasons I love Chinese medicine so much, is because the whole thing of Chinese medicine is a preventative service. So, COVID-19, everybody's like, how you holding up in New York City? And I'm like, my life hasn't changed that much. I was already working from home. I was already struggling to get out of my PJs, in the middle of the day, all those things. And so now is a time. In the past week, I relaunched my website, lindseyelmore.com. I launched a new website, YL Ed Club, which is my Young Living education platform. I launched a podcast, and the Lindsey Elmore Show, which is now streaming wherever you get your podcasts. I am also starting a new foray. I got invited to be one of the first influencers on a new social media channel. It's called Channels. And so if you're familiar with Marco Polo now has a new service called Channels. And I'm launching a new business coaching platform called Brand Strategies Lab. And so if you're someone who has something that they want to sell or they want to be in business on their own, come and check out Brand Strategies Lab. I'm doing a free informational sessions. And so just come grab a free download off of my website, and it'll get you into the emails that will help you to develop your own company. So I got a lot going on at the moment, for sure.
It sure sounds like it. Lindsey, thank you so much for just sharing your story. It's very inspirational, and I think some people will gain some clarity about maybe pursuing this path if they feel brave, I suppose, as brave as you have. But as you pointed out, I think it just takes a little bit of hustle to find those opportunities to make them happen. And as you have demonstrated, once you find your curiosity and you find the problems that you do want to solve, usually more opportunities present themselves to the point where you have to start saying no to things. So congratulations on just like pushing forward and hustling on your career to the point where you are. Congratulations.
Thank you so much. It's an honor to be a representative of pharmacists. It really is, because I genuinely think we are the least acknowledged and the poorest leveraged healthcare professionals. We should be doing so much more. And now is really a critical moment for pharmacists to advocate for one another. So if you got a couple minutes, reach out to your senator or your congressperson and write them a message and just say, like, it's ridiculous that pharmacists don't have personal protective equipment. It's ridiculous that pharmacists don't have provider status, that we aren't the key people in charge of managing medications. And so it's a moment that we can all advocate for each other.
Excellent. Totally agree. Thanks, Lindsey, for being on the podcast.
Hey, thanks so much for having me.